So what have you built inside of Epiphany that's worth knowing about for somebody who's looking in and trying to figure out, okay, what do y'all do?
First thing I want patients to understand is that Epiphany follows a functional medicine approach. Functional medicine is a core process of identifying what is happening down the road. So if I know I'm going to develop diabetes or high blood pressure or some chronic illness down the road, how do I prevent myself from getting there, or at least slowing the process down so I get there later in life? That's education. But it's not only education. How do we develop a strategy that prevents that from happening tomorrow, the next day, next year, but move it on down the pikeway, or even better yet, prevent it from ever occurring?
How do you develop those strategies for patients?
So a patient walks into Epiphany. Sometimes they know exactly why they're at Epiphany, but many times they don't. It's because it's so different than traditional medicine. Traditional medicine is truly about a disease-oriented format. So you have a problem, and then you come to the doctor for your problem, and the doctor takes care of your problem. Again, as described earlier, we are a different approach. We try to prevent the problem from occurring. So somebody walks through the door of Epiphany and we sit them down. First of all, I usually describe what Epiphany is, functional medicine and longevity medicine, and describe what that means for the patient. Proactive approach to their health care. And then what we do, we take a history from the patient. Again, both women and men, they give us a history. And then after that, we send them to the lab and we develop a panel of labs that will guide me in establishing how we manage them. Now, one of the things that oftentimes I'm criticized from both my patients and from my staff is I provide a tremendous amount of information. Very different than traditional medicine. Traditional medicine oftentimes does not educate our patients. They simply say, here's what you need to do, and they don't tell us why we're doing that. So we provide a large amount of information. I have patients read books. We guide them and direct them to people in our industry, meaning the functional medicine world, that are very knowledgeable in this space. And in doing that, I ask the patients to become advocates for their own health. That's the key word. We want to optimize their health, but how do we optimize that? Well, they have to become their own advocate, and then if they become their own advocate, yes, I want to remain healthy. Yes, I want to prevent chronic illness from occurring in my life. And then when you have them as their own advocate, then they're willing to optimize their own health care. I use this example all the time. We have a classroom of students, and all of them in the classroom, except for one person, makes a D- all the way up to an A+. There's one F student, so the one F student doesn't graduate. All of the other students from A+ to D- graduate. I ask you as a patient, is the D- patient equal to the A+ patient in knowledge and desire, whatever you describe as a student? Are they equal? And everybody says, well, of course they're not equal. Why don't we manage patients the same way? And so we use this term, optimize you. I want you to become an A+ patient. And that's very different than traditional medicine. Traditional medicine says if you land in this range, you're okay. But I ask my patients, if you're at 31 and I'm at 99, are we equal in our vitamin D? Assuming that vitamin D is very important in our lives, wouldn't you rather be the patient that's a 99 than a 31?